My name is Mrs. Schauder. I am the school nurse at Royersford Elementary. I am one of 7 elementary school nurses here at Springford Area School District. Can you think of your school nurse's name? I bet you can. It's our responsibility to keep the students, you, and the staff at times healthy and safe while you're here in the building. For the most part, we work in our offices. I bet you've been to your school nurse's office. It's here where we help to take care of students that don't feel well, that are injured, mostly at recess. Sometimes students need to take medicine while they're at school, and sometimes some students need special things to keep them both safe and healthy while they're here at school. Things like checking blood sugar checks, having tube feeds, bandage changes, things that are required for their specific health concerns. So that is the majority of what we do.
Nurses use lots of different tools depending on where we work. A school nurse uses a thermometer, a pulse oximeter, a stethoscope, a flashlight, tweezers, a blood pressure cuff, and lots of Band-Aids, of course. To do our screenings, we use a vision screener and an audiometer. You probably recognize these. And let's not forget about the ice packs. You know what they say.
I absolutely love being a school nurse, but I've only been a school nurse for 5 years. Before that, I did a lot of other things being a nurse. I worked in a hospital. I worked with patients that were having heart surgery, patients that had problems with their kidneys, patients that needed joint replacements, getting new knees and hips. I ran a clinic. I was a case manager. I worked for a pharmaceutical company. And so I'm telling you all this just to show you that when someone tells you that they're a nurse, that can mean a lot of different things. So now I want to talk about all the different things that you could do if you became a nurse.
One of the first decisions you have to make is, where do you want to work? When we think of nurses, we think of nurses working in a hospital setting, taking care of sick patients that have been hospitalized or having surgery. Those nurses work in the operating room. Or you could work in a helicopter, helping to transport sick or injured patients from one location to another. That sounds pretty exciting. You can take care of patients in their homes, home care nursing, or out in the community. You've probably seen nurses giving vaccinations in the community right now. Or you can even work in an office setting. Here are a list of some other nursing positions available, but there are still so many more. You'll also have to decide, what kind of patients do you want to work with? Do you want to work with children like yourselves, or would you rather work with an older population? You can also work with babies, but no matter who you work with, remember that nurses come in all different shapes and sizes. There are even male nurses. So no matter what kind of nurse you decide to become, there is a place for you in nursing. In order to become a nurse, you must first graduate from a nursing program at either a 2 or 4-year college. Then you will sit for a board exam, and once you pass this, you will become a registered nurse. When you see the RN after somebody's name, that means they are a registered nurse. I do want to warn you, nursing is a dirty job. You know, there's a lot of this and a lot of that. And of course, some of this. And that's why we wear these.
I'm going to end my presentation about nursing talking about probably the most famous nurse in history, and that is Florence Nightingale. Some of you may have heard about her. She is considered to be the founder of modern day nursing. She was a nurse during wartime, and the concepts that she came up with to keep patients that are getting better away from disease, preventative care, advocating for people who cannot advocate for themselves, are still all concepts that we use in modern day nursing and in hospitals today. And the reason I wanted to end my presentation with her is because I wanted to emphasize that you have the potential to be great leaders as a nurse in the community, advocating for patients, for people who can't advocate for themselves. It's something that I've done my entire career that I'm very proud of. And if that's something that you're interested in I think this would be a great profession for you to do too. So I hope that I have shed some light on all the great things about being a nurse, and I hope you have a great day. Thank you so much for watching.